Every single day, thousands of people oversat wake up feeling perfectly fine. By lunchtime, many of them are in the emergency room. Not because of something dramatic. Not because they felt sick the night before. But because of something they did in their bathroom that morning. Something so common and automatic that you have probably done it many times without thinking. Before we continue, make sure to subscribe to White Health and share this video with other friends so more people can protect their health. Research shows that this one simple bathroom habit is linked to nearly 40% of morning heart problems in older adults. But most people never talk about it with their doctor. It feels too normal, too embarrassing, or too small to mention. Yet it can be very dangerous. I am Dr. Baz and I have worked in heart health for over 20 years. In this video, you will learn what this habit is, why it becomes risky after start, the warning signs most people ignore, and the simple changes that can protect you starting tomorrow. If you are over 50 or if someone you love is, this information can truly make a difference. This is not meant to scare you. It is meant to help you understand your body. When you know what is happening inside you in the morning, the solutions become simple and clear. Let us first talk about timing, because timing is very important. Between early morning and noon, your body goes through major changes. When you wake up, your blood pressure does not rise slowly. It jumps. In many people oversat, it can increase by 20 to 30 points within minutes. Your heart beats faster. Your blood becomes thicker because you have not had water for hours. Stress hormones like cortisol and adrenaline rise to wake you up. All of this is normal. Your body is designed this way. The real problem is not these changes. The problem is what you do during them. Think about your usual morning. Your alarm rings. You may press snooze. Then you get up quickly and walk to the bathroom. You sit down. Then comes the important moment. You start to push. You strain. Sometimes you even hold your breath without noticing. You are trying to pass stool. If it does not happen easily, you push harder. Almost everyone does this. But inside your body, something serious is happening. When you strain and hold your breath, you perform what doctors call the Valsalva maneuver. This increases pressure in your chest. It reduces the amount of blood going back to your heart. Then when you breathe again, blood rushes back suddenly. Your blood pressure rises even more. For young people with healthy arteries, this is usually not a big problem. But after SAT, arteries become hardened and less flexible. Many people also have silent plaque buildup. The body cannot adjust to sudden pressure changes as quickly as before. So when you strain during the morning surge, you are adding extra stress at the worst possible time. This means you are placing one pressure spike on top of another when your heart is already working hard. This makes your heart more vulnerable to attacks, strokes, and dangerous rhythm problems. A long study from Japan followed more than 40,000 older adults for 10 years. It showed that people who regularly strained during morning bowel movements had much higher risks of heart attacks and strokes. These problems were most common in the first 2 hours after waking up. Researchers called this period the morning danger window. And this is not rare. Constipation affects nearly half of adults oversat. That means millions of people are putting their hearts at risk every morning without realizing it. If you want more life-saving health tips like this, stay connected with White Health and make sure to share this video with your family and friends. Millions of people are straining in their bathrooms every single morning during the most vulnerable time of their day without realizing the risk they are creating. Let me describe a situation you may recognize. You wake up and feel pressure. You go to the bathroom. You sit down and nothing happens. So you push a little. Still nothing. You push harder. You lean forward. You tense your whole body. You may even hold your breath for 10-15 or 20 seconds without noticing. You are just trying to get things moving. When it finally works, you feel relief. You think the job is done. But what really happened is your blood pressure may have jumped by 40 or even 50 points in seconds. Your heart had to work much harder. If there is a weak spot in one of your heart arteries, this is when serious problems can begin. Most people do not realize that they can be straining without knowing it. You may think you are sitting normally. But if you are holding your breath, if your face turns red, if your stomach muscles are tight, you are straining. And it matters. Now let us talk about the warning signs your body gives you. Many people ignore these signs and think they are just part of aging, but they are important. If you ever feel dizzy or lightheaded right after using the bathroom in the morning, that is a warning sign. It means your blood pressure is changing too fast and your body is struggling to adjust. If you feel your heart racing or skipping beats during or after a bowel movement, pay attention. That is not normal. It means your heart rhythm is being disturbed by pressure changes. If you feel any chest tightness, pressure or discomfort during or after straining, take it seriously. Even if it is mild. Even if it goes away quickly. Even if you think it might be indigestion. Do not ignore it. If you suddenly break out in a cold sweat or feel sick to your stomach while in the bathroom, that can be your body warning you that your heart is under stress. If you feel completely exhausted after a bowel movement and need to sit and recover, that is also important. It means your body is working far too hard for something that should be easy. Now you may be thinking that you understand the problem, but you cannot simply stop going to the bathroom. That is true. So let us talk about practical solutions that really work. First, never strain. If you sit down and nothing happens easily within 1 or 2 minutes, do not push. Stop. Stand up. Walk away. Try again later. It may feel inconvenient, but forcing it is much more dangerous than waiting. Second, always keep breathing. Breathe normally the whole time. Never hold your breath. If you notice that you are holding it, that means you are straining and you should stop. Third, try to change your timing. The most dangerous time is the first 30 minutes after waking up. If possible, wait 30 to 60 minutes. Drink some water. Move around a little. Let your body fully wake up first. This helps your blood pressure settle and makes it safer for your heart. Now let us talk about preventing the problem completely. If you are not constipated, you will not need to strain. Water is extremely important. Most older adults do not drink enough. You should aim for at least 6 to 8 glasses every day. A very helpful habit is to drink a full glass of water as soon as you wake up. Keep water beside your bed. This starts rehydrating your body right away and helps soften stool naturally. Fiber is also very important. You should aim for 25 to 30 grams of fiber every day. This means eating more fruits, vegetables, whole grains, and healthy plant foods that keep your digestion moving smoothly. Vegetables, whole grains, and beans are excellent sources of fiber. If you are not getting enough from food, talk to your doctor about using a fiber supplement. Start slowly because adding too much fiber too fast can make constipation worse instead of better. Movement also matters. A simple 20 to 30-minute walk every day helps keep your digestive system working properly. You do not need intense exercise. Gentle and regular movement is enough. Many people do not know that the way you sit on the toilet matters. If you place a small stool under your feet so your knees are higher than your hips, it changes the angle of your body and makes bowel movements easier. This reduces the need to strain and can make a big difference for many people. Now let us talk about medications because this is very important. Many common medicines can cause constipation or make it worse. These include blood pressure medicines, pain medicines, antidepressants, antihistamines, iron supplements, and calcium supplements. If your constipation started after beginning a new medication, it may not be a coincidence. Do not stop any medicine on your own. But talk to Dr. Baz about it. Sometimes there are safer alternatives. Sometimes changing the dose helps. And sometimes simply knowing the cause helps you manage it better. If you take blood pressure medicine, ask Dr. Baz whether taking it at night instead of in the morning is better for you. Some studies suggest that bedtime dosing can protect your heart during risky morning hours. This is not right for everyone, but it is worth discussing. Your overall morning routine also affects your heart. When your alarm rings, do not jump out of bed. Take a moment to breathe and wake up slowly. Then sit up gently. Sit on the edge of the bed for 2 or 3 minutes before standing. This allows your blood pressure to adjust and reduces stress on your heart. When you stand up, do it slowly and hold something for support. If you feel dizzy, sit back down and wait. There is no benefit in rushing. During the first 30 minutes after waking up, keep things calm. Avoid heavy lifting, hard exercise, rushing upstairs, or going out into extreme cold. Move gently. Get rest slowly. Prepare breakfast. Drink your water. Let your body fully wake up. Temperature in the bathroom also matters. A cold bathroom can tighten your blood vessels and raise your blood pressure. Keep it comfortably warm. And if you are home alone, avoid locking the door. If something goes wrong, help needs to reach you quickly. Now let us talk about what to do if you ever feel symptoms. If you suddenly feel chest pressure, strong dizziness, a fast or irregular heartbeat, or cold sweating while in the bathroom, stay as calm as you can. Stand carefully, leave the bathroom, sit or lie down somewhere safe, and get help immediately. Call emergency services or ask someone nearby to call for you. Do not wait to see if it goes away. Do not tell yourself it is probably nothing. When it comes to heart symptoms, it is always better to be checked and be told everything is fine than to wait and risk something serious. Many heart doctors have seen patients who delayed getting help because they felt embarrassed. Please do not let embarrassment put your life at risk. Here is the good news. Most of these risks can be greatly reduced with simple daily habits and small changes that protect your heart every single morning. These changes are simple. You do not need expensive equipment. You do not need complicated medical treatment. You only need to understand what is happening in your body and make small changes to your daily routine. Drink more water. Eat more fiber. Move your body regularly. Do not strain in the bathroom. Take your time waking up in the morning. These are not difficult things. They only require awareness and consistency. Think about it this way. You lock your doors at night to protect your home. You wear a seat belt to protect yourself in the car. In the same way, these habits protect your heart during its most vulnerable time of day. I know that change is not easy. You have probably followed the same morning routine for 30, 40 or even 50 years. It feels automatic. But automatic does not always mean safe, especially as the body gets older and changes. You know your body better than any man. If something feels different, if something feels wrong, if you notice any warning signs we discussed, do not ignore them. Talk to Dr. Buzz. Get checked. That is not being paranoid. That is being responsible. One more important point. If you have heart disease, if you have had a heart attack, a stent, or bypass surgery, if you have high blood pressure, diabetes, or high cholesterol, this information is even more important for you. Your risk is already higher. Avoiding morning bathroom strain is not optional. It is necessary. But even if you feel healthy and have no known heart problems, this still applies to you. Research shows that many people who have sudden heart problems in the morning thought they were fine. They had no idea anything was wrong. Prevention means protecting yourself before trouble starts, not after. So here is what I want you to do tonight. Before going to bed, place a glass of water on your nightstand. Set your alarm 15 minutes earlier than usual. Give yourself time to wake up slowly. Make a decision that tomorrow morning will be different. When you wake up, drink that water first. Wake up gently. Be patient with yourself. Listen to what your body is telling you. Those extra 15 minutes can truly change your life. Because this is not just about avoiding one problem. It is about respecting your body and understanding your risks and taking simple steps that help you live longer and healthier. Your heart has been beating non-stop since before you were born. It has worked for you every second of your life without asking anything in return. Now it needs just a little attention from you. Give it those 15 minutes each morning to wake up safely. Do not place unnecessary stress on it when it is most vulnerable. You can do this. It is not complicated. It is not expensive. It only takes awareness and consistency. And it is absolutely worth it. Thank you for watching on Vital Health. Take care of yourself. Protect your heart. And I will see you in the next video.